Have you ever walked into a doctor's appointment feeling confident, only to worry you might have missed something crucial about your hygiene that could affect your visit? As a female doctor who's worked with thousands of senior women, I'm here to share 9 common hygiene mistakes many make right before seeing their doctor. Mistakes that could lead to embarrassment, misdiagnosis, or even the wrong treatment. From overcleaning with scented products to wearing heavy makeup that hides critical skin issues, these oversights are more common than you think and can have serious consequences. Watch until the end because mistake number 9 is something even I used to overlook, and it could save you from unnecessary tests or medications that don't address the real problem. Stick with me to ensure your next appointment goes smoothly and your doctor sees the real you, so you get the care you truly need. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. Number 1. Overcleaning down there with scented products. Let's have a heart-to-heart, woman-to-woman, about a topic that comes up far too often in my exam room. Many women, particularly those in their 60s, 70s, and beyond, grew up in a time when societal expectations around personal hygiene were intense, almost a mix of pride in being clean and shame if you weren't deemed pristine enough. I see it all the time. Patients, especially senior women, feel the need to scrub their intimate areas to the point of irritation before a doctor's visit, as if they're preparing for a formal inspection rather than a medical exam. I've lost count of the number of times a patient has apologized for not being fresh enough, or confess to using heavily scented soaps, wipes, or powders that very morning to be presentable. Let me be clear, overcleaning your vaginal area, especially with fragrance products, does far more harm than good, and it's time we rethink this habit. Your vagina is a marvel of biology, a self-regulating ecosystem that's smarter than most of us give it credit for. It maintains its balance through a delicate community of healthy bacteria, primarily lactobacilli, that work tirelessly to keep pH levels stable, fight off harmful pathogens, and regulate moisture. These bacteria are your body's natural defenders, preventing infections like yeast overgrowth or bacterial vaginosis, BV. But when you douse the area with harsh chemicals, synthetic fragrances, or perfumed products, think floral body washes, scented wipes, or talc-based powders, you're essentially waging war on this protective system. You strip away those beneficial bacteria, disrupt the natural pH, and leave your body vulnerable. The consequences can be immediate and uncomfortable: burning, itching, redness, or a stinging sensation hours after cleaning. Over time, this disruption increases your risk of recurrent yeast infections or BV, both of which can cause persistent discomfort and require medical treatment. But there's another critical issue that many women don't consider. Overcleaning can skew your medical tests. For example, an altered pH from aggressive scrubbing or a last-minute scented wipe can lead to an abnormal Pap smear result, prompting unnecessary worry or follow-up tests. I've seen patients prescribed antibiotics for what appeared to be an infection, only to later discover it was a reaction to a product like Ocean Breeze body wash or a heavily perfumed feminine hygiene spray. In extreme cases, women have come to me in tears, fearing they've contracted an STD, when the real culprit was an allergic reaction to a lavender-scented powder or soap. So, what's the better approach? Keep it simple and gentle. For daily hygiene and before a doctor's visit, clean only the external parts of your genital area, the vulva, with plain warm water and, if needed, a mild, unscented soap specifically formulated for sensitive skin. Never clean inside the vaginal canal. It's self-cleaning and doesn't need your help. Avoid douching, sprays, powders, or any product marketed as a feminine hygiene solution, as these are often more about profit than health. Your doctor isn't judging your scent. We're far more focused on your overall health. Trust me, we've seen and smelled it all, and a natural, unperfumed state is exactly what we need to assess you accurately. Let your body's natural systems do their job, and you'll save yourself discomfort and potential misdiagnosis. Number 2. Wear tight or synthetic underwear to the appointment. Let me share a story that's all too common in my practice. A few years ago, a wonderful woman in her early 70s came in for her annual exam, dressed to the nines in full-body shapewear, a tight, synthetic garment that hugged her from bust to knees. She laughed nervously and said, "I didn't want to scare you when I undressed." But here's what I noticed. She was visibly uncomfortable, sweating heavily despite the air-conditioned room, with a red, irritated rash between her thighs and across her midsection. Her skin was inflamed, and she admitted she'd only been wearing the shapewear for a couple of hours to look her best for the appointment. This wasn't just about discomfort, it was affecting her health. I completely understand the desire to feel polished and put together, especially for older women who grew up in an era when dressing up for a doctor's visit was a sign of respect or self-care. Many of my patients tell me they were taught to treat medical appointments almost like a formal event, complete with their best outfits. But here's the reality. Your doctor's office isn't a fashion show, a dinner party, or a red carpet. Wearing tight, non-breathable, or synthetic fabrics, think nylon panties, polyester shapewear, or leggings that don't let your skin breathe, can cause a host of problems, especially in sensitive areas like the groin or pelvic region. Tight clothing traps heat and moisture, creating a perfect breeding ground for bacteria and yeast. This can lead to skin irritation, rashes, or even infections that mimic more serious conditions. For example, trapped sweat can cause folliculitis, inflamed hair follicles, or exacerbate vaginal discharge, which might be mistaken for an infection during an exam. I've also seen cases where tight synthetic fabrics contaminated urine samples, leading to inaccurate test results and unnecessary treatments. For older women, who may already struggle with temperature regulation due to menopause or age-related changes, these outfits can also cause lightheadedness, overheating, or even trigger hot flashes, making the visit more stressful than it needs to be. Instead, opt for loose-fitting, breathable clothing and cotton underwear for your appointment. Cotton is naturally moisture-wicking and allows air circulation, reducing the risk of irritation or bacterial buildup. Loose clothing also makes it easier for your doctor to examine you without causing discomfort or needing to navigate layers of restrictive fabric. Your doctor isn't judging your style, we're focused on your health, not your wardrobe. By choosing breathable, comfortable clothing, you're helping us see the real you, including any rashes, redness, or other symptoms that might point to an underlying issue. Comfort is key, and your skin and your doctor will thank you for it. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 3. Applying heavy perfumes or scented lotions. This topic is a bit sensitive, but it's so important that we address it openly. There's a deeply ingrained belief, especially among older women, that smelling bad is something to avoid at all costs. Many of my patients, including those in their 80s and 90s, arrive at the clinic having applied generous amounts of perfume, body spray, or heavily scented lotion right before their visit. For some, it's their signature scent, a fragrance they've worn for decades to feel confident. For others, it's an attempt to mask a medical concern, like unusual body odor, that they're embarrassed to discuss. While I admire the effort to feel polished, these strong fragrances can hinder your doctor's ability to care for you effectively. As a physician, I rely on all my senses to diagnose health issues. Not just lab tests or what I see, but also what I smell. Your body's natural odor can provide critical clues about your health. For instance, a sweet or fruity smell might suggest diabetes complications. An ammonia-like odor could point to kidney issues, and certain infections or hormonal changes have distinct scents. When you layer on heavy perfumes, floral lotions, or baby powder-scented sprays, you obscure these diagnostic signals. It's like trying to read a book where half the words are covered in ink. I can't get the full picture of what's going on with your health. Beyond diagnostics, heavy fragrances can create practical problems in the clinic. In a small exam room, a strong scent can be overwhelming, not just for your doctor but for nurses, staff, and other patients. I've had colleagues leave the room coughing or develop headaches from overpowering perfumes. And during flu season, strong smells can exacerbate nausea for patients already feeling unwell. Many healthcare providers and patients also have allergies or sensitivities to synthetic fragrances, which can make the environment uncomfortable or even unsafe. Here's my advice. Skip the heavy perfumes, scented lotions, or body sprays before your visit. A light, unscented deodorant is perfectly fine for underarms, but avoid anything with a strong fragrance, especially near sensitive areas. Your doctor needs to assess your body in its natural state to pick up on subtle signs of health issues. We're not here to judge your scent, we're here to help you stay healthy. By keeping things fragrance-free, you're giving us the clearest possible view of your health, and you're also making the clinic a more comfortable space for everyone. Number 4. Not grooming toenails or checking foot hygiene. Let's talk about an often overlooked part of the body: Your feet. Many women don't think their feet are relevant to a doctor's visit unless they're specifically seeing a podiatrist, but I promise you, your feet matter more than you might realize. For women over 60, feet can be an early warning system for serious health issues, including diabetes complications, like neuropathy or poor wound healing, circulatory problems, skin conditions, bone issues, or even early signs of mobility loss that could affect your independence. As a doctor, I often check feet during routine exams because they tell a story about your overall health. Unfortunately, foot care is a challenge for many older women, especially those with arthritis, limited flexibility, or vision issues that make it hard to inspect or groom their feet. I've seen patients come in with blackened or thickened toenails, deep fungal infections, cracked heels that bleed, or raw, painful skin between their toes. Conditions they often didn't realize were so severe because they hadn't checked their feet closely in weeks or months. Some try to cover up these issues by wearing closed-toe shoes without socks, slathering on thick nail polish to hide discolored nails, or even avoiding foot exams altogether out of embarrassment. These attempts to hide problems only make it harder for your doctor to assess and treat you effectively. For example, I once had a patient in her late 60s who came in for a routine physical but didn't mention her feet. When I asked to check them, I found a deep fungal infection under layers of chipped nail polish and a small ulcer on her heel that she hadn't noticed. These were early signs of diabetes-related complications that needed immediate attention. Had she not allowed the exam or continued to hide the issue with polish, we might have missed a critical opportunity to intervene. Before your doctor's visit, take a few simple steps to care for your feet, especially if you know they might be examined. If you're able, trim your toenails straight across to prevent ingrown nails, and file down any sharp edges. Wash your feet thoroughly with mild soap and warm water, paying special attention to drying between the toes to prevent fungal growth. Wear clean, breathable cotton socks to keep your feet dry, and avoid painting over discolored or damaged nails, as this can obscure signs of infection or other issues. If mobility or dexterity issues make foot care difficult, consider asking a trusted family member, caregiver, or podiatrist for help. If you can't manage it at all, let your doctor know. There's no shame in needing assistance, and we can connect you with resources. Your feet have carried you through decades of life, and they deserve attention, especially in your golden years. By keeping them clean, groomed, and accessible for examination, you're helping your doctor spot potential problems early, sometimes before they become life-altering. We're not here to critique your pedicure. We're here to ensure your feet keep you moving forward with confidence and health. Number 5. Skipping deodorant completely before the appointment. You might be wondering, didn't she just warn against strong fragrances? I did. But going to the opposite extreme, forgoing deodorant altogether, is a common misstep I see among patients, particularly older women preparing for a doctor's visit. While the goal is to avoid overpowering scents, completely skipping deodorant can lead to unintended consequences, especially during warmer months or high-stress situations like a medical appointment. There's a critical distinction between heavy perfumes and basic personal hygiene, and striking the right balance is key to ensuring both your comfort and an effective visit. As humans, perspiration is natural, and as we age, our bodies undergo changes that can amplify body odor. Hormonal fluctuations, particularly after menopause, can alter sweat gland activity and body chemistry, leading to stronger underarm odor or increased perspiration in areas like the armpits or skin folds. Add in the nervous energy many feel before a doctor's appointment, whether it's anxiety about a diagnosis or simply the stress of getting out the door, and you've got a recipe for what I call the perfect sweat storm. The result can be distracting for both you and your healthcare provider. My recommendation? Opt for an unscented or lightly scented deodorant that prioritizes odor control without floral or perfumed notes that could interfere with a clinical setting. Before heading to your appointment, ensure your underarms are clean and dry, preferably with a gentle, fragrance-free soap during your morning shower or a quick wipe with a damp cloth if time is short. This simple step not only helps you feel fresher and more confident, but also ensures that your doctor can focus on your health concerns rather than navigating an avoidable distraction. Basic hygiene isn't about perfection. It's about creating an environment where you feel at ease and your medical team can do their best work. After all, a comfortable patient is more likely to engage openly during the visit, which is critical for addressing your health needs effectively. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 6. Not brushing teeth or cleaning dentures. It's easy to assume that oral hygiene is irrelevant for a general doctor's visit. After all, you're not seeing a dentist. But let me share a professional insight. Your mouth is one of the most revealing windows into your overall health. As a physician, I'm trained to notice subtle clues during face-to-face interactions, and oral health often provides critical hints about your body's condition. Unfortunately, I frequently encounter patients who arrive for routine checkups or medication reviews with noticeable issues: strong breath odors, inflamed or bleeding gums, or dentures that haven't been cleaned in days, sometimes with visible food particles or plaque buildup. Let me be clear, there's no judgment here. Many women, especially seniors, may not realize how closely oral health is tied to systemic conditions. Unclean dentures, for example, can harbor bacteria or fungi, leading to painful mouth sores, infections like oral thrush, or even digestive issues if food particles interfere with proper chewing. Persistent bad breath or halitosis isn't just a social concern. It can signal underlying issues like gastrointestinal problems, side effects from medications, or even serious conditions such as kidney or liver dysfunction. Poor gum health is another red flag, with research showing direct links to systemic inflammation, heart disease, and even diabetes complications. When patients arrive with unbrushed teeth or neglected dentures, it can complicate our ability to assess these signs accurately. Moreover, I've seen women hold back during appointments, covering their mouths or speaking softly, because they're self-conscious about their breath or oral hygiene. This hesitation can hinder open communication, which is vital for addressing health concerns effectively. To avoid this, take a few simple steps before you visit. Brush your teeth thoroughly with a soft bristled toothbrush, floss if possible, and rinse with plain water or a gentle, alcohol-free mouthwash. For denture wearers, soak and clean your dentures according to your dentist's instructions, ensuring they're free of debris. If physical limitations like arthritis, reduced grip strength, or tremors make oral hygiene challenging, don't hesitate to discuss this with your doctor. There are adaptive tools, electric toothbrushes, floss holders, or denture cleaning tablets that can simplify the process. A clean mouth not only boosts your confidence but also allows your healthcare provider to detect early warning signs that could be critical to your health. By prioritizing oral hygiene, you're setting the stage for clearer communication and a more accurate diagnosis. Number 7. Using talcum powder or scented powders in private areas. For many senior women, talcum powder or scented powders have been a lifelong staple of personal hygiene, often recommended decades ago as a way to stay fresh and comfortable. I understand the nostalgia. Talcum powder was once a standard part of hospital kits for new mothers or touted in advertisements as a must-have for feminine hygiene. However, modern research has shifted our understanding, and what was once a routine practice is now recognized as potentially risky, particularly when applied to sensitive areas like the genitals, under the breasts, or in skin folds. Studies have linked talcum powder use near the genital area to an increased risk of ovarian cancer, a concern serious enough to prompt warnings from health organizations. Beyond long-term risks, powders can create immediate issues during a medical exam. Powders tend to clump in skin folds, trap moisture, and cause irritation or chafing, which can mask underlying conditions like rashes, yeast infections, or skin breakdown. I've seen patients arrive for pelvic exams or skin checks with a visible layer of powder on their inner thighs, in their underwear, or caked in areas like the groin or under the breasts. This can interfere with diagnostic procedures like pap smears, skin swabs, or visual inspections, as the powder may obscure signs of infection or create misleading symptoms due to irritation. Many women turn to powders to manage increased perspiration or odor, which can become more pronounced with age due to hormonal changes or reduced skin elasticity. Others use them to alleviate itching or discomfort in sensitive areas. While the intention is understandable, there are safer, more effective alternatives available today. Unscented moisture-wicking creams, gentle barrier ointments, or breathable cotton clothing can address sweat and odor without the risks associated with powders. If you prefer a powder-like product, opt for cornstarch-based alternatives, but use them sparingly and avoid applying them to broken skin or internal areas. Before your doctor's visit, I strongly recommend skipping powders altogether. This ensures that your healthcare provider can assess your skin and sensitive areas for any abnormalities, from infections to early signs of skin cancer. By keeping these areas clean and free of products, you're helping us see the full picture of your health, unclouded by outdated hygiene practices. Number 8. Forgetting to wash behind the ears, neck folds, and under the breasts. It's easy to overlook the less visible parts of your body during your daily hygiene routine, But areas like behind the ears, neck folds, under the breasts, or beneath an abdominal overhang, sometimes called a panus, are critical to keep clean, especially before a doctor's appointment. As we age, our skin becomes thinner, more fragile, and more susceptible to irritation from trapped moisture, sweat, or skin oils. These hidden areas are particularly prone to problems because they're warm, moist environments where bacteria and fungi, like yeast, thrive. Neglecting these spots can lead to unpleasant odors, redness, rawness, or even serious issues like yeast infections, skin breakdown, or open sores. During routine exams, I've discovered rashes, peeling skin, or even early infections in these areas that patients were unaware of, often because they couldn't easily see or reach them. This isn't anyone's fault. Physical limitations like arthritis, stiff joints, reduced flexibility, or balance concerns can make it difficult to clean thoroughly, especially in the shower where slipping is a real risk. To address this, consider using adaptive tools like long-handled sponges, washcloth gloves, or handheld shower heads to safely clean hard-to-reach areas. A shower chair can also provide stability, allowing you to focus on hygiene without worrying about falls. On the morning of your appointment, a quick sponge bath with mild soap and warm water targeting these hidden areas can make a significant difference. Not only will you feel fresher and more comfortable, but your doctor will also have a clearer view of your skin's condition, enabling them to spot potential issues like infections, pressure sores, or early signs of skin cancer. Hidden doesn't mean harmless. Keeping these areas clean is a small but vital step in protecting your health. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. 9. Wearing heavy makeup to cover skin issues. For many women, especially those who've always taken pride in their appearance, makeup is a source of confidence and self-expression. I completely understand the desire to feel polished and put together, particularly when facing the vulnerability of a doctor's visit. However, arriving with heavy makeup, layers of foundation, concealer, blush, or powder can significantly hinder your healthcare provider's ability to assess your skin accurately, and that can have serious implications for your health. Your skin is a roadmap to your overall well-being, especially as you age. After 60, subtle changes in skin tone, texture, or appearance can signal underlying conditions. For example, unusual paleness or yellowing might suggest circulation issues or liver dysfunction. Easy bruising could indicate side effects from blood thinners or clotting disorders. Dry, flaky skin might point to thyroid imbalances or nutritional deficiencies. New moles, pigmentation changes, or persistent rashes could be early warning signs of skin cancer or medication reactions. But when heavy makeup covers these clues, it's like trying to diagnose a condition through a fogged-up window. I've had patients come in with what appeared to be flawless skin, only to discover, after gently wiping away makeup, an angry rash, a bleeding mole, or scaling patches that had gone unnoticed. In one case, a woman had been covering a precancerous lesion with concealer, mistaking it for dry skin, until a routine exam caught it just in time. To avoid this, consider skipping makeup entirely on the day of your appointment, or at the very least, keep it minimal. A light-tinted moisturizer or a touch of lip color that doesn't obscure your natural skin. This allows your doctor to perform a thorough skin assessment without needing to remove layers of product, which can be time-consuming and uncomfortable for both of you. By presenting your skin as it is, you're giving your healthcare provider the best chance to detect and address potential issues early. Your confidence and health are worth far more than a perfectly made-up face, and we're here to focus on what matters most, keeping you well. That's it, ladies. 9 hygiene mistakes that could make or break your next doctor's appointment. I hope this has been eye-opening and empowering for you. What have you learned so far? Maybe it's skipping the scented soaps, going light on makeup, or giving your feet some extra care. I'd love to hear from you. Please comment below with one thing you've learned today and will bring to practice in your life to make your doctor visit smoother and more effective. If you found this video helpful, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more tips to keep you confident and healthy.